in New York, what we're seeing a lot is a lot of Hispanic people, and the Hispanic people are heavily affected. As you know, by right now, a lot of Hispanic males, diabetes, obesity. These are some of the other factors that I see. So this is what these are the people. And you talk about places like Chicago, there are a lot of African American people affected. So I think in certain ways, the reasons why Hispanic people are affected are, low socioeconomic status, where many people live in very close congregation to each other. The other thing is these people have to work. That's the other problem. So it's very easy for a lot of Americans where they say, we'll send you this $1,200 a month, and then two people in a house, you have something to go, it's okay. But Hispanic people, a lot of the illegal workers, they have to work every day. If they don't work every day, there's no food on the table. So these people go out and work, putting themselves at risk. So that's another factor. And the other big factor I feel with Hispanic people, a lot of parts, there's a language barrier. So you and I, we wake up in the morning, it's COVID all over the place. It's hard to miss. It's different. A lot of these people, they don't understand the language. There's probably not enough talk about this. They're just not getting it. So I think multiple risk factors why we're getting these patients. And I want to also put out that patients from 18 to 50, they account for about 50% of hospitalization. So I want people to realize that, even though the elderly people are the highest death possibly, once an elderly person is on a ventilator, the high chances of dying. And because of the lack of ventilators, clinicians are being forced to make very difficult decisions, who gets to live, who has to die. Let's say we have one ventilator and the patient is we have one patient, young patient coming in, he's about 35. And then you have another elderly patient who's about 85. I mean, who do you choose? And the right thing is probably the way we look at it is whoever has less than 1 year of life expectancy, these are the people who are probably going to have to die. Very complex decisions, very difficult for physicians. But what we usually do is we involve two physicians. We have the ethics committee on board, and they come, they help us out. And it's a group meeting between doctors, ethics committee, and families also. So that's how we have to make these decisions. We've never had these kind of problems before, but because we have ventilators, and a lot of time we just fight. We keep fighting for the patient as long as the family wants it. But these are really complex, challenging times that we've never had before. And it's very hard emotionally for a lot of the healthcare workers because, you see people crying all the time. It's very emotional. It's very emotional just working on the front lines every single day.
How bad is the ventilator situation?
Yeah, we're running out of ventilators. It's a big problem. I mean, nobody really knows like how many are there, but every day New York is a big problem. And now some of the approaches we're doing is one ventilator for two patients. We're using different kinds of techniques, which is not great, to be honest with you. So a couple of the places we have promising, which is Washington State was the biggest, was the first hit state in America, and they're actually giving some of their ventilators. So we're just trying to work together as a nation and, get things done and send things. And we're doing the best we can. Every day it's a hunt for ventilators. Like, here's the problem. You really can't blame the government because no one has really predicted this kind of pandemic. It's impossible to create a plan for this degree of a pandemic. Like I said, this is disease X. We expect to see something else, once every century. And take it to the bank, we will see more pandemics for sure. I mean, it's not a matter of if it'll happen, it's a matter of when it'll happen. So, it's a struggle. Every day, every hospital in the country is looking for ventilators. And sometimes it's hard because, New York is fighting against New Jersey and we're trying to get vents, and we're all the states are in the same predicament, and we're all kind of competing between ourselves, New York and Pennsylvania, New York and Chicago, Illinois. So it is very difficult and it is very challenging. And New York is short right now. My feel is hopefully the surge will end thing. But I feel I want to mention one more thing about the deaths. So the one thing about the situation is the testing is poor. The sensitivity of the testing is poor, which means if you do a test, you detect the case, it can be as low as 65%. So you can miss 35% in certain cases, which is why a lot of times we treat the patient clinically. So if someone comes in with a COVID-like syndrome, I don't care what the swab is going to show. Positive, if it's positive, great. If it's negative, I don't care. I'm going to be treating these patients as though it's a COVID positive case. Now, with regards to the deaths in the US, I mean, they count the deaths only which are confirmed positive. But remember, there are many false negative tests. So that's going to affect the exact death rate. So that's important to know. The other thing is there's a glimmer of hope in New York saying, well, the hospitalizations are starting to slow down. And the caveat over there is, I feel a lot of hospitals are refusing to take patients. They're full. Like, people are dying in emergency rooms, not getting to the ICU. So a lot of times people they say, can you go home? Because we just don't have the capacity. And that patient who's really sick goes home, and he doesn't count in the hospitalization numbers, even though he should probably be admitted. So there are a lot of numbers which, we have to look at all these numbers with a grain of salt, because they may not be absolutely accurate. As a matter of fact, I think, the whole world with their death, the mortality numbers, I feel the whole world really is undercalling it. Many people die at home. They're not tested. And then now we know about this test. I'm not sure about the other countries, but for the US, this is the test that we have right now is pretty bad. We have some new tests which have come out last week, which are fantastic. But think about this, when these fantastic tests come out, every hospital in the country is ordering thousands and thousands, and we just don't get it in time, So I think there are a couple of factors that I have that I don't think is, which makes me really suspicious of these numbers.